Welcome to the United Way Difference, featuring Oshkosh area United Way agencies and events. Your host for the United Way Difference is Executive Director Sue Ponick.
Hi, and welcome to the United Way Difference. I'm Sue Ponick, and I work at United Way, and my guest today is Wendy Schwabe, and Wendy is the program manager for the Parent Connection program at Family Services of Northeast Wisconsin. I wasn't sure if I was going to go with the Family Services first or the Parent Connection, so I thought I better look at how I wrote it. Wendy, welcome. It's been a little while since you've been on the program.
Yeah, thank you for having me.
You're welcome. We're going to have a discussion today, which is a good discussion, but it might not be a pleasant discussion, because we're going to talk about the abuse of children and what we can do to protect children, as well as what this agency is doing, Family Services, and their Parent Connection program to help children as well. So I really appreciate you coming in.
Thank you.
Tell me about the scope of the work of your agency. I know it does a lot of things, and then we can kind of compare it down to your work with child abuse, okay?
Sure. So Family Services focuses on four main areas: prevention, intervention, treatment, and education. And within those four areas, there's about 30 different programs, and Parent Connection is one of those programs. We focus mainly on prevention.
Okay, and how big of an area does your agency serve?
Family Services covers 17 different counties, so pretty much all of Northeast Wisconsin.
Okay.
Parent Connection covers what we call the cow counties. Part of Calumet, Outagamie, and Winnebago.
Okay, I like the cow counties. So talk a little bit about child abuse as just a topic or an issue, and why do we need it seems apparent why we need to be concerned about it, but is it growing? Is it diminishing? What's going on? What's the landscape look like?
It hasn't changed much in the last 5 years. We have a little spike here, a little dip there, but typically our numbers have stayed the same.
And those aren't good, are they?
No.
One is too many. But
absolutely. But when you compare us to other counties, surrounding counties, our numbers may look similar, but the impact is deeper. And we're going to talk a little bit about that when we start talking about ACEs.
Okay.
Yeah.
There's actual physical. Talk about the types of abuse that there are. Okay, I don't want to speak for you, so.
There's physical abuse, which would, everyone would identify with hitting a child. There's sexual abuse, there's emotional abuse, and neglect. Those are the main ones.
Talk a little more about, I think we know the first two, sexual and physical, but how might someone emotionally abuse a child?
By the way, that's the hardest one to prove.
Okay.
And so it's not substantiated very often, but it is put-downs, constant put-downs, or it's a lot of verbal abuse. So
kind of like you're no good message.
Yeah.
Kind of thing?
Yep. You're no good. You're not going to amount to anything. You're fat. So that might be connected to eating disorders, but a lot of just playing with the mind. I guess is probably the easiest way to send that message.
And I don't mean for you to. I don't know if I should even ask this question, but why do people do this? And it's mostly adults, or is it other children, or?
It's both.
Okay.
Adults in general are the ones that, a lot of parents, they may not have had a nurturing upbringing. They may not understand the impact that their words have on their children. There's stress, frustration as a parent, a lot of demands. If they don't have enough finances to support their family, all that stress kind of builds up and spills out. So I don't think it's ever, I wouldn't say ever. Usually you have a child, the first thing you don't say to yourself, I'm going to abuse you. You don't plan to do it.
Yeah, that's a joyful time when you have a child. Yeah.
Absolutely. And so, our goal is to walk these parents through those transitions to help them to lower those stress levels so that we avoid a lot of those abusive situations.
And you do have programs that of the tons of programs that you provide, you do have programs to help with parenting and help parents kind of get through those tough times.
We do.
Okay. In addition to some of the other things. Hey, do you think that computers have increased the number of people who are not necessarily abusers, but potentially with the child porn and all of that? I mean, is it easy to? I would think it's easier to get now.
You know, technology has been a blessing and a curse. You know, you have your information at your fingertips that can help you in education, it can help you job search, it can help you in all those ways, but it also opens the door for predators, for child pornography and for luring kids away, away for sexual issues. But
yeah, I hadn't even thought about it. I mean, I in the back of my mind it was there, but I hadn't even thought about it in this discussion that they can be. But on the flip side, we also do have law enforcement who have computers and
Yep.
the smarts to be able to, in many cases, get people as well.
right. And they have those laptops right in their cars.
Right.
So for them to be able to look somebody up really quick and to not let them go on a traffic violation if there's something more substantial, that they can stop them right then and there. So again, technology is great. It's just how it's used.
Right. And I was thinking about the fact that they might be luring children through emails or those kinds of things, where a lot of times police officers pose as a child and that's how they catch some people.
Yeah, we hear about that in the news all the time.
We hear about that in the news all the time. Right. Well, talk about what ACE is.
Sure.
And, like maybe give me a brief overview of what that study is about. And I think we're going to have a graphic coming up later, maybe not right now, huh?
Well, ACE, the original study started in 1995, 1997. And it was the first large-scale study to compare ACEs and adult health outcomes. So
and what does ACE stand for?
Okay, an ACE is an adverse childhood experience.
Okay.
And what this group did, it was the CDC and the Kaiser Permanente Health Group in San Diego.
Yeah.
They were the first group to do that. They did this survey, and on this survey, it had questions of before you were 18, did these things happen to you? Okay, and each one of those is an adverse childhood experience, an ACE.
And when did they do this? 19 what?
1995
Is
to
the first one.
1997. Right.
Okay. Oh, to 97. Okay.
Right. So they surveyed 17,000 people.
Wow.
It was a big one.
And this is nationwide or just California?
Nationwide.
Okay.
But then what happened is Wisconsin wanted to do their own study. So we had a group of the CDC, Dr. Anda and Folletti. They developed another series of those. They worked with the first group, but they said, let's survey Wisconsin. So they surveyed 4,000 people in Wisconsin.
Okay.
All right, and so that's where we're getting this information from. And it's the Children's Trust Fund, the Child Abuse Prevention Fund, the Department of Health Services, Department of Children and Families. They all work together to fund this project. So it is not just one entity in Wisconsin. It's everybody working together.
And why did they feel that Wisconsin needed to do its own rather than look at the nation? And that's the first part of the question. And the second part is, were we any different? So the first part is, why did they feel they needed to do it?
Well, those are a lot of good questions. I will answer the best of my ability.
Okay. Because, that's right. You didn't make the decision to do
Nope,
the study.
I didn't.
Okay.
So I think everybody wants to know in their own backyard, are you different from the rest? And I think geographically there are different indicators of child abuse, neglect, or poor nutrition or poverty. And so they wanted to know where Wisconsin ranked in that. I honestly can't tell you where we stood among all the other states. I know what happened in our state, and I can talk a little bit about that, but I think you'd have to go to the website to find that
And
answer.
I think we've got a shot for the website coming up later, right?
Right,
Okay.
right.
So let's talk a little bit about the
ACE.
the ACE, the Adverse Childhood Experience.
Sure. So it's a measure of cumulative exposure to adverse childhood experiences. So exposure to any one ACE.
Okay, and I think we've got the graph. There we go. Okay.
Great. So that's what we're measuring, those questions. Any one ACE is 1 point. So,
okay. But I'm going to have you read them because we have
Sure.
people listening to us on the radio
Okay.
and not seeing this. And so they're going to say, oh, well, what are the 8?
Okay, so what are the things they're measuring? They're measuring if there's reoccurrent physical abuse.
And that's by anybody or just in the family?
Anyone in the family.
Okay.
Okay. reoccurrent emotional abuse, sexual abuse, alcohol or other drug user in the household, an incarcerated family member, a household member who is chronically depressed, mentally ill, institutionalized, or suicidal, violence between adults in the home, and parental separation or divorce.
Okay. And these are things that have an impact on the child.
Right. And when you go through this and you say, of the 8, maybe I have 3.
Okay.
It doesn't measure, though, the length of exposure or the number of times it might have happened to you. So if your parent was married, divorced, married, divorced, married, divorced 3 times before you were 18, you still only get 1 ACE. You don't get 3.
Okay.
So it doesn't measure the severity of it or the frequency of it. It just either it occurred to you or it didn't.
Okay.
And so
now there was a picture. I'm going to have the guys go back to that picture that was on the screen earlier there. I mean, so one of the adverse, it doesn't necessarily have to be toward the child. It can just be parents.
It's the environment they lived in.
Okay.
Yep. But that toxic stress.
So the parents here that are arguing and the little girl in the front crying because it probably happens on a regular basis.
Right. And it's exposure to that toxic stress, that development on the brain that impacts that little girl as she grows older into an adult.
So, I know that researchers did this, and so I'm sure that they have all kinds of stuff, but how do they know what the adverse effect is? I mean, how do they correlate those 8 things with neglect and abuse and
in the original study, I don't know that they knew exactly why adults had these chronic health issues.
Okay.
That was really the underlying reason. It was a health related issue. It was like, why do some people have chronic health issues and other people don't? Is it genetic or is it environmental? What is it? And so I think that's why this study came to be. It's like maybe it's connected to the way the environment they lived in as they grew. So that's really why they did the study.
Did they do anything where they compared the answers to the child with maybe later life to find out how they ended up?
Well, they're doing a second survey, I think, is in the works. But so you can only do the survey if you're over 18.
Okay.
So it's what happened to you, not what is happening to you right now, but what happened.
Right, but I mean now, so if that happened to me,
right?
How do they know that impacted my life and in what way? I mean, we know it's going to impact, but in what way? So are they doing a longitudinal study of those same people that answered the question to find out?
A really good question. I'm not sure.
We'll have to look into that.
Yes, I will.
Okay. Because I'm just thinking, does it matter that if someone has someone in their family who's incarcerated, that they're more likely to also be incarcerated, or that some member would, I don't know the answer to that, nor do.
And I think if you, the Children's Trust Fund put out a really nice booklet on the ACEs study, and I think you can go to their website.
Okay.
And it's in full there.
Okay. So if people want more information, and we'll have that website up, so we'll give that information a little bit later on. So we're going to go to break in just a little bit, so I'm not sure if I want to ask you this question now, but where did Winnebago County rank?
Well, we didn't do so well.
Okay. Is this where we're going to see the map in a little bit? Okay,
yes.
We're going to hold off on that a little bit, but how are you going to use this information?
We use this information in our home visitation programs. And
Okay.
so we work with the families and we do the ACE study with them.
Oh, okay. So you're doing your own here.
Well, it's not the study, but the survey we'll do with them. Yep. And
Okay.
so then we're walking that journey with them and seeing if they need additional support, if they've dealt with it, if they're okay, or if they need referrals.
Okay.
So addressing it and then showing them the effects on their children and how to prevent that from happening to their children.
Okay, so we're going to take a quick break, and we're going to come back, and after the break, we're going to talk about how Winnebago County did in the ACE study, and what are some of the things that Family Services of Northeast Wisconsin Parent Connection Program are doing to combat that. Thanks for watching. I hope you come back.
For worse or for better, we Underneath everything we are, underneath everything we do, we are all people, connected, interdependent, united. And when we reach out a hand to one, we can influence the condition of all. That's what it means to live united.
This year, United Way worked to ensure quality childcare for over 6,500 children in Kansas City. To do so, we coordinated the efforts of 95 providers, 11 partners, and 8 different funders. We helped thousands of families in 8 different counties. But the number of centers and services doesn't really matter. What matters are the children now with a chance and families now with a future.
Hi, and welcome back. My guest is Wendy Schwabe. She's with Family Services of Northeast Wisconsin Parent Connection Program. And we were talking about child abuse and neglect and what the agency is doing about it, but also some of the research behind this. And what we were talking about is adverse childhood experiences, or the ACE study that has been done. And do you want to just give us a quick overview for this half of the program so that people just tuned in, they know a little bit about what we're talking?
Sure. So an adverse childhood experience is one of 8 experiences that may have happened to them as a child, and it's for every one of those, it's 1 point.
Okay.
And so there's 8 on the list, so you could have up to 8 adverse childhood experiences. Obviously, the higher the number, the more adverse experiences, and then the more struggles an adult would have.
Okay.
Because of those experiences.
Okay, so that the relationship is 1, you might struggle, but maybe not as much. 2 or 3, you may struggle more by the time you're an adult.
Yeah.
8, you're probably having a hard time.
Like on the list, I believe one of them is separation or divorce in your family. So that would be one ACE. But if that's the only ACE you had, you may be able to go on fine.
And cope.
Right. But if you lived with someone who was an alcoholic, or another person was incarcerated and your parents were divorced, that's going to affect you more. That toxic stress is really kind of embedded in your brain, and so it may affect you more.
Okay. And one of the things you said that the study doesn't do is if there's multiple divorces, let's say, it only counts at one time.
Right.
Okay. So we were talking about how Winnebago County ranked because Wisconsin did its own study, correct?
Right.
Okay. And with the CDC.
Yeah.
And we have a map that's going to show this very visually. And I'm not sure that it's going to come up just yet, but hopefully it will be there in a minute. There it is.
Okay,
and
great.
I hate to say this, but red doesn't look good.
No, red doesn't look good. Let's start with yellow.
Okay, let's start with yellow.
The counties in Wisconsin that are yellow shaded indicate that 10% of that county's adult residents have I might have messed this up. Have the fewer ACEs. So the least amount of ACEs are the yellow.
Okay.
All right. And then the most, which is the red one, Winnebago County, that has more of more of our population. So 20% of our county's adult population have 4 or more ACEs. The yellow ones, less than 10% of the adult population have 4 or more ACEs.
Okay,
Does that
the
make
green
sense?
would have 10 to 15%.
Right.
Okay.
Yeah. And then the purple actually is 15 to 20%
Right.
of their population. So
like yellow is the happier color, I suppose, if you wanted to look at it, because we would think caution necessarily with yellow, but in this case, yellow is the better number.
right. So fewer adults in
Right.
those counties have had adverse childhood experiences.
Okay. And this doesn't really, the hard part of these kinds of studies is it doesn't tell us why and what's the cause and effect of, no, I shouldn't say that, but what might be causing the adverse
Right.
effects and why there are more in our county than in other counties.
And I think if we knew that, we'd be able to change it.
Yeah.
But getting to the heart of why I don't know.
You know, we talk about those root causes all the time, so what is it?
Right. And if we knew, I think we would be yellow.
Okay, so
we don't know.
That's going to be your job.
Right.
And we have another way of looking at the ACE study too, which is this triangle that's going to pop up on the screen in a little bit.
Right.
And it's a little blurry, we're sorry about that, but as you look up that triangle, maybe, Wendy, you could tell us how this goes along with the ACE.
Right. So on the bottom, you'll see that those are childhood experiences.
That's the ACE itself.
That's the ACE. So that's the foundation of who you are.
Okay.
And your health and your well-being, right? Then you're going to move up a little bit, and we'll go to the middle. It's your social, emotional, cognitive impairment,
Okay, that's the purple one.
right? And then we're going to have some health risk behaviors.
In green. Okay.
And then we're going to have some disease, some disability, social problems, and early death. So the more adverse childhood experiences you have, it's a great indicator of early death.
Okay.
And we don't want that.
No.
You know, our public health is working diligently on changing how we function in our community. Our healthcare providers, the hospitals, the pediatricians. We have the way to the Fox Valley. We have, we're getting kids out, trying to get them active. Mm-hmm. We're really trying to prevent that early death. And yet we're looking at these adverse childhood experiences, and we know that those experiences play a role in risky behaviors and early death.
Right. So if people want to learn more about this study, they can go to the website, and we're going to put a picture of their that homepage, I think, up on the screen, and that will allow people to then write down the website. But maybe for those people, well, if you're driving, please don't try to write this down. Pull over and while you're listening to this program. But if you're sitting at home listening to this program, pull out a pencil and write this website down, because this would be a good one to review. So it is www.acestudy, so ACESTUDY.org. And then if you want to go to the ACE survey itself, it's a /ACE_score. Okay, but they could probably find that by just navigating the website as well. Okay. And so if you want more information, I would welcome you to go do that. And if for some reason you can't find it, we're going to have Wendy's information at the end of the program, and you'll be able to email her or contact her, call her, and find out. So now that you've got this information, and you know that Winnebago County is one of the worst, what are you doing about it? What are some of the programs that your agency is being able to help families with, so that they can get beyond this?
Well, two in particular. So the first one is our parenting education workshops, and partnering with United Way, we have that ability to offer these parenting workshops at a very low cost to anyone in our community. We want to be able to give them the tools to be able to address their child's behaviors in a way that doesn't stress them out and cause some of these adverse experiences for children.
So if I come to one, what might I expect?
Well, you're going to get some tips and tools. And specific.
Are there people just like me there?
Everybody's there.
Okay.
Everywhere, anyone from a nurse, we've had come to child care providers, we've had parents, we've had single moms, we've had teen parents, we've had single dads. Everybody's welcome.
And you probably have parents with multiple children.
Oh, yeah. Yeah. Because your first one is stressful, but imagine your third.
Right.
It's even more stressful.
And if you had an easy first one and the third one maybe is a little spunky, you might not be ready for this.
Right. And I think in the past, people have been afraid to ask for help. But I will say, I think I took the Love and Logic class when my daughter was 15, and I thought, oh, this could have been so much easier if I would have done it when she was 4.
Okay.
So I think, don't be afraid to ask for help. Come to a class and learn.
And how long are the classes, and how often do you meet?
Each class is different. But typically they're 2 to 3 sessions, 2 or 3 nights, a couple hours each night. So they're not a huge investment.
And not necessarily nights in a row. No. It's over a couple weeks.
So like, for example, a Love and Logic class is 3 or 4 nights.
Okay.
And so it's 3 or 4 weeks, and then you're done.
Okay.
So
and like, you don't have to get tested or anything like that. And it's like, you have to do role playing.
No, the facilitator does a really good job.
Okay, I just, I don't make people assured that when you go, that it's learning.
It is.
Okay.
Yeah.
So that's one program is the parent workshops. And what's the other program that you said that you really?
It's our home visiting program. It's our Parents as Teachers program.
Okay.
And we've been doing home visiting. We were the first Parents as Teachers program in the state of Wisconsin. We've been doing it for a long time. But we've changed it and tweaked it at the national level and also at the local level. So instead of just providing child development information, why does your baby's brain grow this way, or why do their eyes go cross-sighted, those kinds of things, we're really getting into the depths of parenting. So we're doing the ACE survey with them, Adverse Childhood Experience Survey.
So you're doing the survey with the parents themselves,
with them, because
so that you can see how many. What are we calling those
ACEs?
ACEs they have,
and not so much we don't really want to know how many ACEs they have, but where are they in life? Are they resilient? Have they overcome that? Do they need some help? Because you add a child to that, and a lot of those feelings might come back, and we learn what we've learned, right?
You're right.
And so if you didn't learn positive, or you weren't a part of a positive environment when you were growing up, how would you know to provide that for your child? So we want to prevent these adverse childhood experiences for their children. And so the only way we can do that is to educate them and help them through their process.
Okay. Now, you also do 2 other programs, trauma-informed care and supervised visitations.
Right.
Do those relate to the ACE, or are those just good things to be doing?
The supervised visitation, it's short term. We're providing a service, so it doesn't really, we're not able to do much about the ACEs. A lot of those families that would come in, I would guarantee you, have had adverse childhood experiences.
Okay.
And the trauma-informed care, that's our focus for the year, for our agency, and for a lot of the programs that we're involved in at the state level, is we really want to understand what trauma has played a role in these parents' lives, and how is it that we can help them through that, or direct them to professionals who can walk them through that, so that they can parent in a healthy way.
Okay. So what as a community, can we do to lower that ACE score?
Well, I think there's a number of things we can do, but we have to be aware, number one. Number two.
So increase awareness.
Right.
Okay.
And we can do that because there are master trainers in the state of Wisconsin.
Cool.
That Children's Trust Fund has trained, and they are sent out all over the state. All you have to do is request them.
And who would they be training?
They train everybody from the school districts to child care providers. We had one come to our United Way building to do all our home visitors in the area. Anyone who's interested in learning about the ACEs and how it affects children that they're working with.
Okay, and as we start to wrap this up, besides the master trainers, are there other things we can do as a community?
Well, I think we need to be aware and not put labels and judgments on people.
Stay informed.
Yep.
Okay, if people want more information, Wendy, how do they get in touch with you?
They can reach me. We're in the United Way building, or the Hooper building, and which is 36 Broad Street. It's Suite 150. Or they can call me. The phone number is 233-6630, or they can go to our website, which is familyservicesnew.org.
And NEW stands for Northeast Wisconsin.
It does.
.org, and you can always contact them as well if you misplace this information. Give us a call at the United Way office as well, and we can make sure that we connect you. So thank you for being here.
Thank you so much for
this
having
is
me.
interesting. I'm going to follow up on this.
Good.
Thanks.
You're
And
welcome.
thanks for watching.